Hey warriors, this is our first lesson into psychotherapy. That is a specific approach to psychotherapy. Now remember that the goals of psychotherapy is to help a client seek a new way of living, to change their feelings, their behaviors, and improve their way of life. Psychoanalysis, the mastermind behind psychoanalysis, you should know by now, is Sigmund Freud, and their goal is to help clients gain insights into problems by recognizing unconscious thoughts and emotions, and then analyzing how those unconscious thoughts affect current behaviors and feelings. We've looked especially at Sigmund Freud in the units prior to this in personality and mental disorders, and central to this approach is the assumption that personality and behavior reflect the efforts of the ego, trying to balance our id and our superego. And that creates your personality. So psychoanalysts are going to look for understanding these conflicts and how they affect the client. It's usually going to be, no, it's not usually, it's always going to be one-on-one, discussing the client's history and current problems, and then finding links between the unconscious and those current problems. So first we'll talk about Sigmund Freud's methods and tactics, and then more recent developments. Freud's history in psychotherapy began with a client that was hysterical in the way that they had temporary blindness that was onset by no physical cause. And you may recall what that current practice is called, where we have no physical explanation for a physical disability. It's called conversion disorder. Sigmund Freud's exploits into conversion disorder sometimes did temporarily help the conversion, the temporary paralysis or blindness. And sometimes, they worked. Sometimes the person would get the ailment like 3 weeks later. Throughout working with clients, he transitioned into different tactics, and what he ultimately settled upon was, you see him on the couch there, he would separate himself from the client. The client would sit on the couch, and then Freud would sit to the side of the couch so that the client could not see his reaction when they would tell him things from their unconscious. And this is what he called free association. So just talk out your problems, talk out your day, talk out your stuff, for like an hour, maybe longer. And in some cases, he talked to some people for like 5 hours at a time, which is amazing. But when you're on cocaine, that probably helps. But this is called free association, where we just say what's on our minds. All right, early Freud tactics, again, included free association, where the client relaxes and they just say whatever comes to mind. And you've heard me talk about Freudian slips. Sometimes the Freudian slips would come out in those free associations, and that's just a glimpse into what's going on in the unconscious. Unconscious thoughts will then break through while we are free associating. Now, early in his career, Sigmund Freud used hypnosis to get a glimpse into this free association and this free stream of consciousness, but he eliminated hypnosis later in his career because it was found to be false memories and things. But the patient relaxes, lies on the couch, and just sits and the therapist sits and listens. And then the therapist is left to tell you what it means. The patient just omits things that seem trivial, irrelevant, sometimes even shameful ideations, and sometimes mind goes blank and they may need coaxing to continue on. They may joke or they may change the subject, but it really doesn't matter what they're saying, because ultimately, again, it's up to the therapist to say, well, this is a glimpse into what is going on in your unconscious. Freud's other approaches included dream analysis, because dreams to Freud were a glimpse into the unconscious thoughts and feelings. This was the expression of the unconscious in the dream content. So content can be analyzed from two different ways, and that is the manifest content, the actual storyline of the content. The dream follows this story, or the latent content, which was the hidden meaning behind the dreams, up to Freud's interpretation. Later in Freud's career, he found that people had resistance. And of course, this was when a client's hesitancy to discuss issues raised during free association, so they resist. Maybe their id is not willing to reveal what's going on in this particular area. It might happen when there's a joke, when they can't think of a word, something serious, and they change the subject entirely. It was believed that resistance was a defense mechanism, and this is meant to repress or deny painful feelings. The therapist is left to interpret the meanings of these things and discuss the importance of it. Again, later in his career, he discovered this thing called transference, where we transfer feelings of one person who we may be frustrated with, and then that transfer gets taken to the therapist themselves. So as the analysis proceeds, many clients begin having the trusting relationship with the analyst, and those are similar to the feelings that they have had with the person in their lives, to the patient's lives. So they may experience these similar feelings towards the analyst and expect the analyst to feel and behave as the other person did. And Freud might have done that. The client is transferring these feelings and expectations from one person to another. Now, this is useful for the psychoanalyst because they make use of the transfer and help clients to express themselves and analyze the unconscious feelings that he or she has towards them. And in fact, establishing this transference relationship is a major goal, because then it gives them something to work with. You can expose the unresolved feelings and problems and then work your way through those feelings and problems in order to help solve the current situation. Example. So the patient may begin to feel the same feelings towards his or her therapist as the patient does towards his or her lover. So they might love the therapist. And these types of feelings can be positive or negative. It could be love, it could be anger. So the therapist must be aware of this phenomena and may even be able to use it to help the patient. Now, I'll show you an example of this in class. It's from a movie and it's kind of wild, but it's definitely a great example of transference. Well, does this approach actually work? Is it our unconscious that is preventing us from living a fruitful life? Well, if you're a psychoanalyst, you would definitely say yes. But many psychologists feel that Freud placed too much emphasis on sexual and aggressive urges, and I'm among one of those people. Freud definitely, his theory has a lot to do with sex and sexual aggression and urges, and it's very male dominant. So it's not a comprehensive perspective when it comes to treatment and psychological theory. However, Freud did some amazing things that nobody in the late 1800s, early 1900s was even thinking about. And his best work probably, and this is just me based on what I know, comes from dealing with patients with anxiety and depression, because the talk therapy really did lead to some advantages. Some argue that Freud underestimated the importance of conscious ideas and changes and gave too much emphasis to the unconscious. But Freud's works in psychology is no doubt one of the most influential in psychology. But this works best, psychoanalysis works best for those who suffer from anxiety, depression. Freud was not going to work with somebody who had schizophrenia, who had hallucinations and delusions, and he generally was working with people who had money and could pay him. So maybe not the most troubled people, but definitely persons that were disturbed. To conclude on this, does it work? Does psychoanalysis work? Well, yeah, it treats anxiety and mild depression and difficulty with relationships, because you're like taking a microscope to those relationships. So yes, it can work. But Freud and psychoanalysts are not going to treat, like I said, schizophrenia or more disordered behaviors. Usually, if it's psychoanalysis, you are working with that person pretty intensely over a long period of time. And we can reduce that down to brief psychoanalysis, which would be 10 to 20 sessions a few months per year, and focusing on specific problems. I do believe that psychoanalysis could really help people with the anxiety and the depression. However, it's not a full-time fix for somebody with more serious illnesses. And I admire the work that Sigmund Freud did for the world of psychology. However, not everything's about the male genitalia. All right, more later. Thanks.